Name is Paul Park. I'm a neurosurgeon. I deal mostly with spine surgery. It's something I have a passion for. I deal with all aspects of spine surgery, not just degenerative conditions such as stenosis or disc herniations, but also complex spine disease, scoliosis, deformities, spinal tumors, trauma. I actually treat the full gamut of diseases, and that's what I was doing at the University of Michigan, and it's what I want to do here. As a kid, though, I wasn't sure what I wanted to do, like anyone else. But in college, I ended up working with a few physicians, actually, and scientists who work with physicians, and it became an area of interest for me. In medical school, I thought I was going to be an infectious disease doctor. At the time, there were a lot of medical shows like ER and everything. If you recall that at all, I'm dating myself, but it made you want to be an ER physician or an infectious disease doctor. It made you want to, help people. And neurosurgery was not something that was on my radar. Actually, how I wound up as a neurosurgeon was actually by chance. So I was randomly assigned to a neurosurgeon for a clinical skills rotation in my second year of medical school. And I actually saw some surgeries, and it's one thing when you see something on a TV show, when you're actually in the operating room, and at the time neurosurgery, when people think about neurosurgeons, they think about brain surgery. And that's actually one of the first operations I saw. And when you see someone having brain surgery, you see the brain, and you're like, oh my gosh, that's something maybe I want to do. And that really started, the seed in me that I wanted to look into neurosurgery. I'm very passionate about research. I think it's a way to develop better treatments for a variety of spine conditions. In fact, it's something I do whenever I can. I don't have many hobbies. Really, my hobby is spine. And number one goal is to make sure we do the right thing so patients can be better. And so that's why, whether it's developing new surgical techniques, new medications, new technology, that's the main goal. One of the best operations we do is a discectomy. You see them recovery, and when they say they feel better and pain's gone, it makes my day. I just have a good mood throughout the whole day. I feel like the world's a little brighter. I feel like I've made a contribution to society in some way. I've had my own issues. I ruptured my Achilles. I couldn't walk for a little while. So I felt, it puts a different perspective on you when you have your own medical issues and then you're functionally kind of limited. And so I think I'm a better physician for that. I even have a cervical disc herniation for a while. My left arm was a little bit miserable about it. I was considering having surgery myself. So, I could understand patients better now. When someone comes in with say neck and arm pain, I can relate. I really can relate to it. So I do think being a little older and having your own issues is helpful. I'm very fortunate. I think a lot of people, take a job or enter a career, and sometimes they just don't like it. But I enjoy what I do. And so the best part of being a physician is if you make someone better. Absolutely, you just feel good about it. And it makes your day.